I'm going to move now. We've got Dr. Mike Ryan. Sinead, have we got Dr. Mike
Yes,
Ryan?
yes,
Brilliant.
we do, Danny, yeah.
Brilliant, fantastic. Okay. There you are. Hello, Mike. Good morning to you.
Good morning to you.
Oh, good morning. And listen, sorry, we got a wee bit ahead of ourselves. In your absence, I was regaling everybody with your bio, and I wanted to fully understand, Mike, the background that you have. You know, I was saying that we just got to kind of see you and get to know you this time last year. You were honestly, you were the voice of reason. You were the voice in the dark. You were very clear about what we needed to do in terms of a COVID response. You were the first person I think that I really sat up and took notice. And then I was very, like everybody else that's on the call, very proud of the fact that you come from the Emerald Isle as well. You're a good Sligo man. So, and you know, when I don't know which member of the committee it was, it said, let's try and get Dr. Mike Ryan. I don't know who it was. It wasn't me. We didn't think it would happen. But listen, with the responsibilities you have and what you're trying to achieve and what you're trying to do, thank you very much for joining us this morning. And I know, look, we're just going to have a chat, Mike. My name's Danny Elliott. We're just going to have a chat, and I'm going to try and bring in a little bit lots of questions for you, Mike. So I'll try and bring them in. But I was just wondering, Mike, did you hear that the presentation by Anne there? Did you get a chance to hear it?
Yeah, and I didn't. It really resonated with me because the politics of exclusion and isolation and lack of access and what's unfolded in this pandemic, I've said it in other fora, it's really not only has the pandemic itself caused its own problems, but it's ripped away bandages from very old wounds in our society. They're the wounds of equity and access and dignity. And it's exposed a lot of things that are already there. They're not new, but what it's done is really brought them to the fore. And we've seen marginalization and stigmatization and stereotyping for whatever reason, whether it's the Kung Flu virus or whether it's targeting of Asian Americans, or it doesn't matter whether it's at global, national or local level. We've seen information and bias and stereotyping around this virus. We've also seen some very good things. We've also seen information used to empower. We've seen solidarity. We've seen people come together as communities to support each other. So we've seen the best and the worst. As we see in all crises, you see the best and the worst comes out in us. We only hope that we can find a way to amplify what's best in our behavior as people and communities. And we can get rid of those very ancient and very, very strongly held biases and stereotypes, which forced all peoples. You know, we as a people, as people from Ireland, spent decades and centuries being stereotyped abroad. And unfortunately, as a society, we've placed and imposed stereotypes on many groups in our own country, and particularly on the traveling community. Very proud, wonderful people who deserve the dignity of their culture and participation and equal opportunity and equal access under our laws. So it's just a microcosm really of and Anna's very, very, you said it, a hugely articulate speaker, a wonderful voice. I was sitting here listening and just thinking we could have this at the World Health Assembly, not just in the not only in the change makers. So Anne, we might be back to you at some point and ask you to come and speak to a larger audience, because speaking on behalf of those who live within a society but on the edges of society, never being fully accepted, always having to justify their existence, is something that many, many people and many peoples around the world face every single day.
Yeah, well said, Mike, and it would be a wonderful opportunity for Anne if you could make that happen. It would be fantastic. Mike, at a global level, can I ask this very selfish question from me, because it was I'm head of Self-Help Africa, Northern Ireland, and I get to talk to our teams in Uganda. Every 2 weeks we have a team there in Uganda, and just on Tuesday morning I was having a chat, and I have had one vaccine at the minute. I get my second in May. One of my colleagues who was with me from Fermanagh has had two. And we were talking to Esther, who's one of our speakers coming up later on this morning, and who provides a leadership role in Uganda. And we were kind of talking about the sense of guilt. That I have a complete sense of guilt when I feel I'm half vaccinated, 75% protected. Ethna was 100% protected. And I was making that point to Esther, you know, I feel bad about it. There's no equity. It didn't seem fair. But one of the things that we talked about was that the kind of rumors around AstraZeneca in particular, and the kind of fear factor or suspicion factor around the vaccines at the minute, they made the point that they feel there's a low uptake of the vaccine in Uganda. Is that something that you're seeing throughout the global south, Mike? Or where are you on that, or how would you address that?
You know, there's a lot of questions, and there there's a lot of, you made quite a few points. First of all, I don't think any individual should feel necessarily guilty for getting a vaccine. We all need to take care of our own health and the health of our families. The equity is not driven by you sitting in a GP's clinic and taking or not taking a vaccine. The equity is built into the system at a much higher level. It's built into the system on the governmental contracts, on the production, on the manufacturing, upstream, and then we live with the guilt downstream, right? That's pushed onto us, right? So I think we need to push that back up the stream, right? We need to maybe use that feeling to activate and motivate. And you that's why I do and have come to a forum like this, because it's fora like this that matter. It's communities that matter. Communities, you know, we still live in a country that's in countries that are on principle democratic. They're supposed to, you know, the demos and kratik from the Greek is kratik means power and demos means all the people. Well, if that's democracy, then all the people have power. And I think communities need now to speak to governments about how they're feeling, exactly what you're feeling. Is that sense of, my God, is there someone else who needs this vaccine more than me? And quite frankly, we are entering a phase where there are many, many people around the world, frontline health workers and highly vulnerable people in developing countries who are not getting this vaccine, while we're starting to see very, very young and reasonably healthy people in some other countries getting it. I'll give you an example. If we look at the high-income countries right now around the world, 30 out of every 100 people have received a vaccine in high-income countries. We're getting up towards a third. Do you know what that number is in developing and low-income, in least developed countries and low middle-income countries? It's 1 in 500, not 29 in 100. It's 1 in 500 people in those situations. And we're going to see the death rates continuing to rise in those countries as our death rates fall. Our caseloads may go up because the vaccines may not stop transmission, at least not for now, until we get very high rates of transmission. But we're already seeing huge falls in death rates in people over 65 because they're getting vaccinated, and people with underlying conditions. And we should continue to do that. Governments should protect their most vulnerable. Every government has a duty and a right to protect its own citizens. The question is then, when you go beyond your community and your county and your country and then your region and the world, you have to have a bigger perspective. What's the best way for the world to get out of this pandemic? And right now, the way we're distributing vaccine is not the best way. It is not the best use of this precious resource. But people shouldn't feel guilty. With regard to vaccine hesitancy in many countries, it's driven by many factors. Misinformation. Normally, you know, we're giving vaccines to very young kids, and it's parents who make that decision on behalf of their children. Getting adults to take vaccines is not a very common thing. You know, you get your vaccines before you go on holidays, but other than convincing adults to interrupt their daily life and go in and take a new vaccine that's on an emergency use listing, for which all of this information and misinformation out there is quite tough. There are all of the various data that's come out around safety issues and other issues. That's caused a lot of confusion in people's minds. And in some countries, you know, we're not giving some vaccines to the over 65s, and then in other countries not giving it to the under 30s. You'd forgive people for feeling entirely confused with the various mixed messaging that's going on. And I think we have a duty in public health to get our messaging right to people, because we're in danger of messaging our way out of vaccine demand. And there is a strong vaccine demand, and there's a very strong vaccine demand in Africa in particular. But there's also a great deal of skepticism as well, and rational skepticism. People don't, and you know, working in developing countries, communities have a natural skepticism of the outsider coming in with solutions that are pre-cooked, don't you? You know, and therefore any information that in some senses adds to that paranoia around that external vaccine and the conspiracy theories around why that vaccine has been used. We've seen that with polio in countries where it was seen, and misinformation and conspiracy theories about vaccines being used to sterilize women or being used to do mind control. We've seen all of that happen in this pandemic. But right now, the information on these rare but significant side effects is also causing an issue. And we do know with the AstraZeneca vaccine that there is this very rare clotting condition. It's extremely rare because you have to vaccinate millions of people before you see it, but it's still there. But people have to have that information so they can make a good decision. The vaccine is still safe, but it does cause side effects. I was looking at data the other day on the number of people who die in dentist surgeries after getting local anesthetic, which is actually higher than the rates of people who get seriously ill with AstraZeneca vaccine. So everything has a side effect. Even if you go and take a paracetamol tomorrow or you take an aspirin, there are side effects. The issue is whether or not the side effects are outweighed by the benefits of the therapy or the drug or the vaccine. And right now, it is still very, very clear that the benefits of taking any of the vaccines clearly is hugely beneficial. The risks are very, very low, but there is still a measurable risk, and people need to be aware of that risk, and they need to make informed decisions.
Massive challenge, so Mike, isn't it? When you think about it, like, let's say a region where we're working, Teso in northeastern Uganda, which is highly rural area, isolated villages, and people are hearing, it's very, very hard to. It's very, very hard to crack that, Mike. It's very, very hard to go in there and overturn those suspicions and whatnot.
The problem. Yeah, the problem is, and you know this working at community level, it's very hard to come in as the knight in shining armor when you haven't been there. No one's been there for years. The health system is not working. People feel marginalized. And then you come and start telling people what to do from the outside. That's what people in communities often, and we see the same in Ireland. We see the same in the United States and other places. Why wouldn't populations be hesitant about any external intervention? Because many of them say, where the hell have you people been for the last 10 years and 20 years when we've had diabetes and hypertension and drug abuse and physical and sexual abuse, and we've had all of these things going on in our community, and it didn't matter. Now it matters to you lot because you want us all vaccinated so we can end the pandemic for you people. That's the attitude you get everywhere. And you can't call that irrational. And my problem in communications is people go in and start trying to counter people's beliefs rather than come in and understand why people believe things, and then try and have a dialogue around those beliefs, and then give people information that they can process into a new belief, rather than giving people beliefs and giving them ways, giving them things to think. We need to give people the means to think differently, not give them propaganda, because the propaganda is coming on the misinformation side. And for me, you don't counter propaganda with propaganda. That is not sustainable. And communities then feel double manipulated. They feel they've been manipulated by the conspiracy theorists, and they've been manipulated by the so-called people who come to help. If you look at death rates in this pandemic, you look at who's dying in this pandemic in many developed countries, their deaths were foretold in their access to healthcare over the last 30 years. Unmanaged diabetes, unmanaged hypertension, unmanaged obesity. The seeds of our own destruction have been laid in lack of access, lack of equity, lack of affordable healthcare, privatized healthcare. We've commodified, made health into a commodity that we buy and we sell and we trade, not into a human right that people have access to. And the reason people you see dying in our ICUs, the people you see gasping for breath, are very often people who have had underlying conditions because they've had unmanaged healthcare issues for years and years. And that is the essence of this. And it's the same in an African environment. People have had lack of access to care for a very long time. They have other issues. It's not just COVID that's bothering them. They have kids dying of malaria and people with malnutrition, and they have people with all kinds of parasitic disease and other unmanaged conditions. For many people in an African environment, COVID's just another day at the office,
Yeah, no. Listen, I absolutely agree with you, and that brings me then to, one people thinking about what defines you, Mike, and not that I know you or anything, but just having research and seeing you on television or whatever. What defines you is kind of this pursuit of fair. You talk so much about fairness and equity, right? You really do, and you give great examples about, look, if we're looking after the most vulnerable and most at risk in society, shouldn't that be on a global scale? Why are we only thinking about in rich countries? We should be thinking about those at most risk, those most vulnerable on a global scale. And you talk about when I think about it, Mike, it's like you have a vision for a fair and equitable world. It's more aspirational. And where are we in that? Because you talk about the COVID-19 and the response, how we respond to COVID-19 being to tell the tale of whether we're going to create a fair and equitable world. Where are we? Where do you think we are with that?
We're a long way behind the curve, mate. And yes, I try to be aspirational about those things, but also to be practical. This pandemic has brought us, from a healthcare point of view, socially and economically, it's brought us really down to our knees and it's locked us all up. It's stopped all of the key aspects of our lives: weddings, funerals, basic social gatherings, human contact. How long is it since some of us have hugged another human being? Basic need and drive in humans for social and physical contact has been interrupted. We're a society interrupted by this pandemic. Now, that interruption is very painful and very tragic, but also it is only at moments. Only the things that have ever changed on this planet in human society have only changed through crisis. We've rarely sat down and planned our way to better things. Very often, and in our own personal lives, change is mediated through crisis, very often. And it is really then examining how you're getting out of a crisis and then saying, you know what, we can't have this again. This has got to stop. How many times in your own life have you said, this has got to stop? I've got to do something differently, be it on your finances or relationships, be it in your community with drugs or anything else, right? There's a moment where we as individuals or we as a community say, enough already. This must stop. We need to find another way. And I think that's the moment we're in.
Unsure of where it's going, though, Mike.
Yeah, and no one has. I think the thing here is that don't let the politicians and don't let people like me give the answers. This must come from the bottom up, right?
Yeah.
Too many solutions are cooked at the top and then trickle down to people. That's why I speak at a lot of community events and other stuff. For me, this is about community. There's no such thing as global development in my view. All development is local. And it folds up into something that becomes global, but it is at its core about communities. And I think if we want to think about a future state that we want to be in, what do we want? Do we want to live in a society where our kids go to school in prefabs and where our parents spend 36 hours on a gurney in an emergency room waiting to be seen for a perfectly treatable condition? Do we want to live in, it's not just about COVID. It's about what type of a society do we want to live in? And what we've seen is those inequities we see in our own society: inequitable access to good quality education, inequitable access to good quality healthcare, has been written on a global basis with the inequitable access to COVID vaccine. All COVID vaccine inequity is doing is demonstrating the structural inequities in our society at a global level. It's revealing. It's not causing anything. It's just revealing something. And it's the same with climate. It's the same with other existential issues. These issues have been revealed to us. We cannot no longer ignore them. In life, sometimes, again, I'm sure I've done it, where you spend a lot of time denying the problem you're in, be it personal or be it anything else, right? Yeah. And there's a certain moment where you can no longer avoid the issue. You just got to face it.
Bite the bullet.
And I think that's where we are now. Yeah. We have got to face that. And I've said it many, many times. I'm rather ashamed at the planet we're handing over to our kids. And people of a certain age like you and me probably need to wake up and smell the coffee and realize that we haven't done such a good job. No. We really haven't. And we've got time to maybe make it a bit different and create. We won't fix the world. We need to create the conditions in which our kids can fix the world. and give them a chance to do it. And right now, the way we've structured our society, the way we deliver and the way we distribute healthcare, the way we deliver and the way we distribute wealth and other things is just not working for this planet, and it's not working for the civilization. And we need to find a better way to do it. I don't have the answers. I'm not, I'm just one of these people screaming from my little hilltop. But if enough of us do it, if enough of us say, no, this must stop, we must find another way. If there's enough of us doing that at one time, then I think we can make a difference. That's all.
Yeah, yeah, and it's amazing that you brought that. You talk about that, because one of the things I think about often is there's kind of like a perfect storm at the minute. You have the COVID-19 pandemic, the rise of right-wing governments throughout the globe. We're looking down the barrel of probably recession, maybe even depression. Let's not even talk about global warming and climate injustice and all of these things. But and you think, like, you don't have the answers. You're right. How could you have the answers? But just in relation to that perfect storm and access to global healthcare, how do you think that's going to be impacted in coming years? Are you optimistic about, can you see a way through, just looking at that one area of access to healthcare, for example? Can you see a way through it all?
Yes, I mean, I think we are seeing change. And we have seen, for example, in COVID, countries like Thailand, others in the Mekong area do better in COVID very often because they've invested in basic primary healthcare infrastructure over the last 10 years. So in many countries where we've seen an investment in primary healthcare, access to basic essential services. When we talk about health, we often talk about disease care. We talk about disease, but let's talk about health and the fact that, the vast majority of human beings are born onto this planet with an innate capacity for health. And in fact, it's life and the environment that destroys our health in some way or enhances our health. So our health is determined by our behavior, by our society, by our conditions, by our wealth, by our environment, by everything. Yeah. And therefore, I do see people saying we need to put more health into life, and create a better life and livelihood for people around which health is not a constant threat, or the fear of being impoverished by losing health and having to pay for healthcare is not a constant stress in people's lives. So I do think there's a sense that we can do that. There are many good examples around the world of projects that demonstrate how we can deliver primary healthcare. I mean, even in the way we train our medical staff, we're very oriented towards tertiary healthcare, and that's very important. If I get a brain tumor tomorrow, I want a really good neurosurgeon and I want a really sophisticated treatment, absolutely. Yeah. But that's not what most people are dying of. No. Most people are dying for lack of access to, Anne was saying, water. They're dying because of a lack of, they're living in polluted indoor environments. They're being exposed to so many different negative things for their health. So when we talk about being able to ensure that at that front line, that we have people taking care of people's health, preserving health, promoting health, and restoring health. Our vision of healthcare right now is about restoring health to people who've lost it. We need to broaden that to preserving health and promoting health, and to take a much more holistic view of a healthy human being. What is a healthy human being? And the productiveness of that human being, and how important that is as an economic driver of a society. Health is seen as a cost right now. If you go to the Dublin or Belfast or London or wherever, and you ask them to talk about health in government, they talk about how much health costs, and how much the health system costs. It's a cost. It's not an investment. But when they talk about development plans and they talk about industrial development, they talk about development and investment, but they talk about health as a cost.
Yes, that's right. Oh, I know.
So maybe we need to be talking about health investment plans, not health costs. And I do think there is, we know how to do it. We know what needs to be done. And universal health coverage is, for me, one of the single biggest symbols we have for the 21st century, that every single person on this planet will have access to essential health services without fear of economic devastation. And if we had that as a basic principle, and then if we add to that the principle on pandemics and epidemics, that we would, if we could commit to two things out of this pandemic. One, that we will never sleepwalk our way into another pandemic in the way we have in this one, and we will be more fair, fast, and equitable in our response. And if we could commit that our healthcare systems will become more responsive to people and communities and give unfettered access to people for basic health services without fear of financial devastation. If there are two wishes I would want to put in my letter to Santa, that would be, they will be the two, you know.
That would be it. Mike, can I go to the wee chat room here? Just a wee minute, fire a few quick round questions at you. There's somebody here saying, wonder what Michael thinks about the TRIPS, TRAPS waiver scheme and why the EU in particular is showing resistance to having this scheme.
Yeah, I don't understand. If we can't get these waivers now, when are we ever going to get them? I mean, really? I mean, if a global pandemic doesn't trigger this process, then when? Are we going to wait for people to invade from Mars? I mean, what? I mean, I'm sorry to be flippant, but I just don't get it. If we cannot waiver these issues now, then they can never be wavered. We may as well don't call it a waiver anymore. There's no point. There's no such thing, you know?
Is there any society, a country that gets most of it right? Who's doing it well is a question.
It depends on where you are in the world, but I would say there's a lot of generalizations. There are countries that have done it very well in all regions, but I think in Southeast Asia and the Western Pacific, I think you'll see different countries, different economies, South Korea, Singapore, Vietnam, Laos, Thailand, the Mekong sort of area, New Zealand, Australia, Fiji, and they've all got different contexts. Some are island nations that have probably a better opportunity to protect themselves. All have had problems with COVID. But I think the single biggest factor has been countries in which they've had a very comprehensive plan. They've not focused on just one thing. They've had a huge focus on community education and community resilience and knowledge and participation and ownership. They've had a big focus on public health surveillance and the ability for the essential public health functions to work, like case finding, contact tracing, testing, investigation, cluster investigation, quarantine. Strong healthcare systems that had surge capacity already in them. In Singapore and New Zealand, Australia, a lot of countries had extra capacity in their system for this kind of an eventuality. And good governance, a system of government, and it's not ideologic here, it's not left wing, right wing. It's a system of government that recognized the need to engage with and create a contract with communities that sustained their collective efforts over the last 16 months. And I think they're the magic pieces. Not every country, no one country has done it the same way. There is no formula. But I think being comprehensive, persistent, consistent has been the formula. A strong focus on communications, a strong focus on community-led responses. We haven't leveraged half enough of our communities in this response. We tend to see communities as recipients and beneficiaries. I hate that word, beneficiaries. God, I know. Right? It sounds like someone that gets insurance after someone dies. You know, it's like, it's weird. I think it's not about serving communities or it's about releasing and empowering communities to own it and respond. I've worked in epidemic response for damn near 30 years in some of the most remote and dangerous places in the world. Epidemics begin and end with communities. Okay. Doctors like me don't stop epidemics. Communities stop epidemics. And until we learn how to fully empower, and I don't mean engagement and communication. They're nice, they're good terms. I mean empowerment. I mean actually allowing the community to become a central pillar in the response itself, not a recipient or a beneficiary of the response. And that's very scary for governments and others, because that level of localization and democratization of response scares the system, because the fear is you lose control. And I don't think you do. I think you have a central plan, you invest in that plan, you bring communities in. I think communities are very responsible. Communities actually are, because they have the consequence of, if you get it wrong at community level, it's your neighbors that suffer. Yeah. Many people higher up in the system live in the land of no consequence. There's no immediate consequence to them of making an error, making a bad decision. I'm much happier putting decision-making in the hands of communities, because they bear the immediate accountability to your peers, to people around you. And I think people are much more responsible in situations like that.
Mike, last question for the chat room. Do you think that following the pandemic, the idea of one health, that animal health and human health must be approached together? Is that something you agree with?
Yeah, no, I mean, at least 70%, probably more, of all the diseases we have in terms of emerging diseases in humans are direct transfers, zoonotic transfers, basically diseases that cross from animals to humans. And that's been driven to an extent by the way we engage in intensive animal husbandry, but very often our domesticated animals have lived with us for centuries, and we've adapted to their diseases and they've adapted to ours. So in that sense, our normal animals are not really a major threat. The problem is when those animals have contact with wild animals, or when we have contact with wild animals, that's when a problem. So farmed wild animals and many other situations. So as we encroach into pristine environments, as we engage in the trade illegal of wildlife and others, there's huge opportunities for viruses to pass back and forth between bats, small rodents, other animals, and humans. And right now, we've got a lot of 7.4 billion people on this planet. We're occupying every space and every corner. We're moving around more and more. So the opportunity for disease to emerge is increasing. The opportunity for diseases then to amplify in poorly managed health centers or in refugee camps or in slums. And then the opportunity for that disease to propagate around the world in less than 24 hours. So there are three factors: the factors that drive emergence, the factors that drive amplification, and the factors that drive that global propagation. And all three of those factors have been turned, the volume has been turned up to 10, right? On each of those three factors. So we have never lived in a riskier environment. On the other hand, and to counter that, we've never had so much opportunity to work together. Our very connectedness is our weakness, and that very connectedness is our strength. The question is, which is going to win out? Is the risk associated with the way we're connected in the world going to be our downfall? Or is that connectedness at community and at global level, the scientific communities, the activist communities, is that going to be our salvation? And to an extent, that's in our hands now. There's no question that globalization has brought with it many risks that are unmanaged. The real question is, can we use our own powers as individuals and communities to counter that risk?
Mike, last question. You know that we have an audience here, it's nearly 100 people or whatever this morning, and we're all involved in development of some description, be it health or education or in the global south or local communities like Anne and the Travellers. What is the one thing we should all take away this morning? What's the one thing we should remember that you're saying this morning? What's the one key message from you this morning to all of us that's involved in this field?
Well, first of all, my greatest respect to you all, because you're the people that make the difference working with and at community level. That's where I wish I was most of the time, I can tell you. I just want to get back to doing what I used to do before. One message, I think one of your, Frances O'Donnell put something in the chat there that I thought was great, which said her 5-year-old daughter offered her piggy bank money as a solution to the vaccine problem.
Right.
That's my message, is everybody matters. It starts with one. We often say in epidemiology and public health that we talk about epidemics and we talk about populations and we say N equals 7.4 billion. This word N is the kind of the nominal number of people you look at or observe in a study. Well, for me, N equals one. One life matters. One person in an ICU matters. Their future matters. Their family matters. One activist matters. One community group matters. If we externalize the solutions, Something Must Be Done Club. We have a great club in Geneva. I call it the Something Must Be Done Club. You know, the people who stand up at meetings and say something must be done, right? They never do it. They're just great at telling other people. I'd rather be in the we're going to do something about it club. And I think the message I would have is every one of us, it doesn't matter if you're Anne working with a traveling community, you working with development communities in Uganda, everyone has a voice. And now is the time to stand up and use that voice. And whether you're Frances's 5-year-old daughter standing up using her voice and holding up her piggy bank, or your communities you're working with in Uganda, or Anne's community she's working, or my communities, We all have a
Yeah.
voice and we all have power. Remember, democracy, democratic, power of the people. We need to put power back in the hands of people to shape the future of our society, and stop relying all the time on others to do that for us. All of us have that responsibility.
Thank you so much. Thank you so much, Mike. And listen, can I just say on behalf of all my colleagues at Changemakers and all the attendees this morning, well, thank you so much for taking the time this morning. I know you say that you come on to talk to community groups. You can see the value of it because everybody's getting an awful lot out of what you said today, myself included. Mike, it's been absolutely brilliant. And I know you've got hell of a weight on your shoulders in terms of what you're trying to do, and you've our best wishes, and hopefully maybe at some stage, Mike, I know you're a Sligo man. I have a wee cottage down in southwest Donegal, Glenties there. I'm not about to with me. Maybe we'll get
You never know.
through the dark and out
Well,
into the light, Mike. We'll get a pint sometime.
Absolutely, I would love that. And I'll have to find out if myself and Anne are related, because I have a number of Friels in my family along the line, so we may actually be related somewhere. You can't be that far apart in Ireland, as you know.
Well, Anne's going to be up there with you on the stage at these big
Yeah,
okay, Mike,
it was a wonderful, great pleasure, and congratulations to all the work you're doing, the Changemakers. I was really fascinated and very attracted to the whole idea when I was asked, and in fact, my staff were quite surprised. Something from Inishowen and the Donegal group and everything. Well, why would you want to speak at that? But I think for me, the connections you're making in this project are just phenomenal, because they're making issues that are seen as local, global, by seeing the commonalities between the struggles that people face in an island community versus a community in Uganda versus a community like our traveling community or others. And we all face, from a different perspective, very similar challenges of isolation, marginalization, and other things. I just found it very, very inspiring to see such what you would not normally think as a group that would coming together for a project like this. So truly it is change making. So congratulations to all of you.
Thank you, Mike. Thank you. Good morning, and hopefully see you again.
All right. Thank you.
Thank you. Thank you.